Good afternoon, everybody. I think we're going to get started here. It is exactly 1 o'clock. We appreciate having you all on this webinar today. Today's topic is sustainability. It's not as easy as you think. And I'm guessing that most of you have already caught on to that. Today we will be talking much more about sustainability and some ideas and tips and thoughts about how to incorporate a sustainability plan, particularly in relation to this SPINS initiative, the HIV Housing and Employment Initiative. My name is Jane Fox, and I am here today to kind of open this up. Can we move to the next slide, please, Marina? Thank you. So instructions for our conference call on Zoom. Clearly, this is not the first time we've done this, but I will remind you all. This webinar is being recorded. The saved recordings will be available on the ETAP website. Please use your computer or telephone audio for this call. Don't use both. To minimize the background noise, all attendees are currently muted and will be for the duration of the webinar. But if you have a question or a comment, please use the chat box or raise your hand virtually so we can unmute you. See the bottom black bar to find the space where you can type in the chat box or raise your hand. And then if you're experiencing any technical difficulties, please let us know in the chat box immediately so that we can attempt to mitigate those and fix them not only for you, but more than likely other people will be having the same issues. Next slide. As I said, my name is Jane Fox. I am the co-PI of the Evaluation and Technical Assistance provider for this HIV Housing and Employment project funded from HRSA SPINS. And can we move on to the next slide? Today, we'll be hearing from our colleagues from California, Ron Brooks, who is an assistant professor at UCLA School of Medicine, and next, Janet Myers, who is with the Center for AIDS Prevention Studies at UCSF. Both Ron and Janet are longtime SPINS recipients, we sometimes call them SPINsters, in the nicest way possible, and have worked on several SPINS initiatives and have dealt with this issue of helping sites figure out the sustainability piece. Next slide. So our learning objectives today, we're going to do 3 things. The first one is identify common strategies for sustaining and integrating your SPINS interventions. The second, we want to start developing strategies that you will be able to use to ensure successful interventions are sustained. And the third is revisit the sustainability and program integration plan you created and included in your original proposal. And then taking some of this information, revise it based on your local context in the SPINS program expectations. And just to reiterate, HRSA has been very generous over the years funding these demonstration projects with the idea of successful ones we would love to see sustained and integrated into the standard of care at each one of these sites. So that is the expectation of the funding that you've received, and we definitely are right here to help you do that and think some of these things through. Next. And so HRSA SPINS initiatives, the purpose of these SPINS projects are to show how to best improve services and health outcomes for persons living with HIV, and they're meant to show and showcase innovations particularly related to this initiative around housing and employment to help transform and improve the larger HIV system, both in the Ryan White services, in your community, sometimes, as small as in your clinic, but also beyond. Next slide. So I'm going to turn it over to Ron, who is going to talk about sustainability plans. Thank you.
Thank you, Jane. And good morning or good afternoon to everyone, depending on where you're at. So as Jane mentioned, we're going to be talking about sustainability and integration. And I just wanted to mention or remind people that sustainability plans are required as part of this initiative. If you look back at the notice, NOFA, the Notice of Funding Opportunity, it states that sites need to include a plan or strategy for project sustainability and program integration, i.e., how you plan to integrate your proposed model into standard operating procedures. So sustainability plans developed by sites really are the framework for how you're planning to diffuse your innovations into the larger HIV care system, and ways that the sites can support that, and ways that the plan can support the diffusion. Next slide, please. So sustainability, really, you want to think about it as a continuum, going from, on the left, you have the least complex activities, such as dissemination or integration, to the more complex and challenging activities, such as sustainability and scalability. So in this presentation, we will go through each of those 4 activities. So I did want to mention, though, that when we talk about sustainability, some of the literature says that you really want to start thinking about sustainability in the planning of your interventions or your programs. But I think that we're at a point now where we can think about sustainability, because it's really about sustaining or integrating portions, either a complete intervention or components of an intervention that are successful. And since at the beginning we don't know whether we're going to be successful, we need to wait until we've actually, these are all pilot projects, we need to wait to see whether or not we're successful. So we're at a good point now to decide whether or not our intervention would be replicated fully, or whether they're just components that we would like to integrate into other services. Next slide, please. So as I mentioned, we're going from the simplest to the more complex. There are many ways to disseminate information about your program, but here are just a few examples. You really want to think about and continue to communicate with other agencies and inform them about your program and ways that they might be able to replicate it if they feel that it's appropriate for their agency. There may be agencies that already have the skills and capacity to be able to implement a program like yours, but what they need is that information. So that's where the intervention or replication manuals come in. The more detail you can provide to an agency that's thinking about replicating it, the easier it will be for them to replicate. You also want to continue to sort of self-promote your intervention or your program. And this is often done at conferences, national conferences such as the one that just occurred, which is the National HIV Prevention Conference. They did have a section on HIV treatment services. You have the United States Conference on AIDS, which their deadline is April 5th for abstract submissions. So if there's something you want to present on your intervention, that might be a good place to present. So you really want to start thinking about disseminating that information about your program. Next slide, please. The next step or next activity that you might want to get involved in is integrating activities. So under integration, you're not integrating the full intervention or program, but rather you're taking key components or aspects that have been successful. And you want to integrate these components of your intervention into other existing services within your agency. So you might do that by cross-training other staff to use those components or aspects of the intervention as part of their own program. So it might be that you have case managers, medical case managers who are focusing on treatment and treatment adherence, et cetera. But this might be an opportunity for them to also engage with patients about employment. And maybe you were using motivational interviewing as a way to facilitate employment activities as part of your intervention. So you would cross-train other staff within your agency or clinic to be able to use those components with their own clients. So you want to integrate components or aspects into complementary or similar types of services, as I mentioned, such as medical case management, linkage or peer navigator services, treatment or adherence services. So integration, if you think about it, it's a way to support sustainability by using existing funding sources. For example, presenting your intervention as a form of peer navigation or peer navigation. So it's really, you're really going to sort of dissect your intervention and think about those components as we're now in our second year, which seem to be really working well, and how you might be able to continue to use those particular components in other services in your agency. Next slide, please. So sustainability is defined as the degree to which an innovation continues to be used after the initial efforts to secure adoption are completed, or it becomes a routine part of care delivery and continues to deliver outcomes. Sustaining your full or an abbreviated version of your program is possible. So it might be that you have this large program and it works well, but you can't sustain it because it's too large. So it might be that you need to abbreviate your intervention in some way to be able to sustain it within your agency. So some research suggests that for programs to be sustainable, there needs to be a continuous interaction among all relevant stakeholders during both the development and implementation process as well as the evaluation stages. Next slide, please. So as part of sustainability, you want to build and ensure community partnerships from the very beginning of planning and implementation. This is one way that successful activities and programs can be sustained after the primary external funding ends. So those of you that have partnerships, you want to make sure that you continue to sort of foster those relationships throughout this whole intervention, the 3-year period of this initiative, so that when it comes to an end, people are, or agencies or planning bodies, are familiar with your intervention or your program and see that it's significant or see that it's important and may want to replicate it. Community partnership and ownership are enhanced when community leaders in particular show appreciation for the interventions and perceive the program as being effective and relevant in solving a recognized problem. Again, it's those community leaders that you want to target, that you want to bring to the table to talk about your intervention whenever and wherever possible. Next slide, please. So when we talk about sustainability, we also have to think, there you go, perfect. Nope, try one more time. Forward. The other way.
The other way, is that right?
We're working on it, Ron.
Okay.
Sorry about that.
It's just doing.
There you go.
Sorry.
It's okay. So when we think about sustainability, we also have to think about the agency and whether or not it's possible to sustain the program within the agency. And so here are some things that you need to consider. One is program need. You will need to show that there is a need for the services provided by your intervention for your agency. You will need to demonstrate program quality. You will need to show that it's both efficient and high quality. Program effectiveness, and this is even more important. You will need to show that your program is effective in achieving the goals that you've established. And last is a program champion. And this has been shown in a lot of literature to really be a significant factor in being able to sustain a program, is having some kind of champion either at management or senior management level that can advocate for the continuation of your program. Next slide, please. So here are some tips for sustaining a program that you might want to think about. So one is location. It is possible that you can co-locate with or within other organizations to share costs, where appropriate, of course. Alternate funding. So you want to explore funding from other Ryan White program parts and or private foundations. If possible, you might want to seek funding for Medicaid or private pay reimbursement, or by instituting sliding fee scales for patient payment. Again, this is where appropriate. We've mentioned this before, but it's also important to cross-train staff. So leverage the program by including additional staff, whether or not they are funded by the initiative. So as you're training your staff, invite other staff that are not part of your program to be part of that training so that they're familiar with their program, or even gain the skills that they can use in their own program. Next slide, please. Document success. I don't think I can stress this enough. You want to collect data to show project efficacy, that it's an effective program. But more importantly, you want to be able to present and discuss these findings in a persuasive manner. Programs that deliver evidence-based outcomes are more likely to secure funds and to get external buy-in from either a health department, a planning council, or other planning bodies. Again, that's part of the dissemination process where we talked about doing community presentations, presenting your findings, or presenting your project at national conferences. Again, there are different things that you can do to not only document your success, but disseminate those findings as well. I've already mentioned this, but having an internal champion, that's extremely important to be able to sustain a program once funding has ended, because without funding, you really need someone at a senior level that's advocating for the program, saying it's important, it's needed, and we can integrate it using these various other sources of funding. Next slide, there you go, thank you. So just to reiterate some of the sustainability factors, you want to identify other funding sources. Again, maintain and foster partnerships and collaborations that you have as you put together your program. But more importantly, also, you want to assess your organizational structure, readiness, or capacity to support the intervention after the funding has ended. We mentioned these key program factors in sustainability, that you need to show that there's a need for your intervention, that your program is of high quality and efficient, that your program is effective in achieving the goals that it established, and also having that program champion. Next slide, please. So now we're moving on to the last step in sustainability, which is scalability or large-scale adoption. And as you can see in red, we have go big or go home, and this is really big. So you want to expand, the program. When you're talking about scalability or large-scale adoption, you're really talking about expanding the program to serve other or larger patient populations, and or to be implemented in other settings or other geographic locations. So scalability is defined as the potential of performing the intervention on a large scale. For instance, by extending the intervention from one district to the entire state or region. So that's one definition. Scalability is also defined as deliberate efforts to increase impact of health service innovations successfully tested in pilot or experimental projects so as to benefit more people. And that's really where we're at. These SPINS funds are for these pilot projects, and this is an opportunity to create innovative models, which we are now testing to see whether or not they're effective, and if they are, to be able to use them to benefit more people. Next slide, please. So when you're thinking about scalability, it's important to assess whether the characteristics that made the program successful in a certain area or with a certain population are sufficiently present in the larger context that you might think about scaling it up to. For instance, if the intervention is targeted to HIV-positive young people, this may not be scalable in a larger geographic region where the age of the HIV-positive population is much older. In that context, you're going to have to require changes to be made to the intervention before you can scale it up to the larger population. So it's just something to think about, like your target population. A lot of you have very specific target populations. Are they reflected in the larger population where you might want to scale it up? So it would be inappropriate also to scale up an intervention that is not sustainable. Therefore, identifying the factors of sustainability are needed first to facilitate appropriate scale-up of interventions. Again, those key factors were identifying other funding sources, maintaining your partnerships or collaborations, assessing your organizational readiness. In terms of program factors, whether there's a need that you can show that you have a high-quality program, that it's effective, and that you have these internal champions or even external champions that are passionate about your program and can sort of advocate for it at different levels, whether it's at the agency level, Ryan White Planning Council level, or local health department. Okay, next slide. So one thing that I discovered when putting together this information was that there is funding available, which is under the 340B drug discount program. So for those of you that are not familiar with it, the 340B program provides hospitals and clinics the opportunity to purchase medications from manufacturers at a very steep discount, but they do not reduce the reimbursement rates that they receive from when they are charging for those medications from insurance companies. So therefore, they create this profit. Now, the profits from 340B programs are supposed to be used as a financial buffer for medical facilities that are serving high-risk and very high-need populations. So here's a list of some of the organizations that are eligible for 340B additional funds. So if your agency fits in one of these categories, you may want to sort of identify who's managing your 340B funds and see if those funds are available to possibly sustain or integrate portions of your intervention in your agency. Next slide, please. So now let's talk about some potential action items. As I mentioned, some literature says that we would be late in talking about sustainability and that we should have been talking about it from day one. I believe that because we are pilot projects and need to really figure out whether or not these interventions are effective or what components are effective, that we're at a good stage right now to be having this discussion. So what you want to do at this point is really start thinking about creating a sustainability plan. Again, no matter what level, whether it's the more simple activities from dissemination or integration to the more complex activities. But definitely some things that you want to do, really, and it's more about diffusing information about your program, is to meet with program officers from Ryan White Parts A and B. If you have a Ryan White Planning Council, ask to present your findings at one of those meetings. Meet with your local health department. It is important to let your local health department know about your program, particularly about the innovations that you have within your program, and let them know about the success that you've achieved. Some agencies may feel that it's also possible to talk to their state health departments about sort of sustaining or integrating these services statewide. Another key player would be your local AETC or AIDS Education Training Centers. Again, They do a lot of training with providers about improving services, medical services, and support services. So you might want to talk to them about how they might be able to use your program as part of their training. Excuse me. Next, please. So when you're thinking about your sustainability plan, here's some things to think about. So what has worked? You want to highlight key elements of your project that have improved outcomes for your particular target population. What are those components or those aspects of your program which have made it successful? You also want to think about what hasn't worked. So what do you plan to discontinue and why? What are the key elements of your project that did not improve outcomes? Or it could have been that you were not able to effectively implement those particular aspects of your program. What are the key activities that are no longer needed? So both what's positive and what's sort of been difficult or challenging within your program or intervention. Next slide. What do you plan to support and why? So again, we're at a critical stage now where we can actually start thinking about whether those pieces or that type of information. Do we want to sort of possibly replicate the complete intervention or maybe an abbreviated version? Or are there particular aspects or intervention activities which seem to work extremely well that we think we can replicate through other services within our clinic or other type of medical providers? You want to think about how you plan to continue supporting these services and interventions. Again, I want to stress that this is where you really want to be able to identify that, that internal or external champion at a senior level management, that can really advocate for this program. Keep them abreast of your progress throughout the initiative. And then you want to describe possible sources of funding that you can either seek as we sort of come to the end of the initiative in terms of being able to sustain your program. Next slide, please. So what I did here was I've been on a couple of SPINS initiatives, and each one is required. I think for almost all SPINS initiatives, demonstration sites are required to develop some kind of sustainability plan. So what I pulled here were just some examples of what other sites have done from past and current SPINS initiatives. So the first one is replicate the intervention internally with different departments, divisions within our agency, particularly those funded by Ryan White. Bullet 2 was prepare replication procedures. Again, the more detail that you can provide in your replication manual or intervention manual, the easier it will be for someone to be able to do what you're able to do. Develop procedures for modifying or adapting intervention to a new department or division or target population. So again, I can't stress this enough that we have with this initiative particular target population. It may be that you would want to broaden the selection criteria for individuals that would be included in an intervention or activity or program that you would want to scale up. But you also have to remember that you would need to adapt your program to the various different target populations if you decide to change the target population. And the last bullet here, which is really important, is to develop a procedure or plan for keeping intervention content up to date and relevant. So we're at a stage where we're using the resources and information that we have today to be able to do these interventions, which are integrating housing and employment. But will those services or resources be available 2 years from now? And if not, how will you be able to update or your intervention activities for the changes in what's going to be available to implement your intervention? Next slide. Another point is making the intervention staff training curriculums available for other agencies wishing to replicate the intervention. Again, it goes back to all your procedures, your policies and procedures, any training curriculums that you have. Those would be useful for other agencies. Another thing that you might want to think about, if you can't or your agency can't really support sustaining the program, but there may be agencies that can do it, is to be able to provide technical support to those, whether it's internal departments or external agencies that are interested in replicating the intervention. Third bullet is identify most effective significant components for replication, which we've talked about. Last bullet is seeking additional funding, in particular from different Ryan White parts such as A, B, or C. We've also talked about the 430B drug money. Next slide, please. You also might want to establish a fee-for-service plan that will cover expenses, but not make a profit to support those seeking to replicate the intervention. Again, this comes back to that technical support. It may be that an agency wants to implement your particular program, but needs your expertise. Since we're not able to make a profit with these SPINS money or federal funds, but you can do something that's where you establish a fee for service. So maybe your program consists of doing, for an agency to be able to implement your program, they would need like a 4-day training. You can charge for that as long as you're not making a profit. So maybe it's the staff time to do that training and the resources and materials that will be used in the training. You can charge for that to cover your own expenses. Second bullet, establish a plan for performing updates. This was to apps, so this was for our social media initiative as new versions of smartphone or operating systems are released. Prepare a plan for promoting the intervention. Again, if you shift the target population as you decide to sustain or scale up your intervention, you'll need new promotional materials. And the last bullet point, again, is something to think about, particularly if you have partnerships with academic universities, where you could use your intervention as pilot data for an NIH-funded research project to sort of dig in more deeply into doing a more rigorous evaluation where you have a comparison group and you can actually show that there's efficacy with the intervention. So just something else to think about in terms of sort of continuing to have your intervention or your program evolve into something that can be sustained over the long term. So that ends my section. I'm going to turn it over to Janet. We'll be talking about sort of the steps that we've sort of already talked about. Janet? If you're talking, you're on mute.
Hey, Janet, are you still on the line?
She says, I'm muted, can't unmute.
Oh my goodness. We'll take a look and see.
Host has me muted.
Let's see.
There we go. Hi guys.
Yay.
Yay, there's Janet.
Yeah, that was too bad. I wish we were unmuted because I was trying to laugh at a couple of points and then sigh and also agree. But anyway. Okay, so I'm just gonna, these are actually for everybody who's on the phone, these last couple of slides we just wanted to cover because they come from guidance directly from SPINS. SPINS has put together a nice document outlining sort of the background of why we care about this issue and you know, sort of the history of why we do, and then some very specific suggestions for thinking about sustainability, and we just wanted to go through these. The document is available to everybody, so we can post that in the, what's our project management software? Basecamp. We can paste that. It's Basecamp, right, that we use? What's that thing called?
Yep, that's what we use.
Okay, great. So we'll post it in there if we haven't already. Anyway,
Yeah.
just wanted to run through these. Some are repeats of what Ron just covered. The first and foremost, just like Ron said, making sure that you can demonstrate effectiveness is important. Taking it seriously is equally as important. I think that's kind of true, and certainly academics are guilty of this, of developing, really cool projects and then sort of dropping them off at the doorstep. So it's sort of, as people who are interested in improving care for our clients, I think it's important for us to think about sustaining effective interventions once we've tested them ourselves. Set clear and realistic expectations. Ron touched on that, I think. Build capacity, that goes without saying. That's that issue that Ron talked about of training, cross-training staff, and sort of integrating services as much as anything. That's also capacity, I would consider capacity building. Consider ways to institutionalize or incorporate all or some part of the effort into existing ongoing organizational or community operations rather than continuing it as a separate project. Ron definitely covered that. I would say that's really important, and sometimes in the real world, I feel like you have to carve off the piece that is feasible and hopefully the most desirable piece, and put your effort into getting that moving. Ron and I have worked on the Latino initiative for the last few years, and there's a couple of sites that I can think of that have really peeled off pieces that they found that worked and really focused on getting those integrated. So I think that's important. Ron touched on collaborating with partners, so community partners and government partners, Ryan White partners, that's all true. And then documenting and evaluating outputs and outcomes as marketing tools, that's true. I feel like that one, sometimes when you get into the integration and sustainability of an intervention, you stop measuring it as rigorously, which is appropriate. But this is a good point. I'm thinking of my SPINS colleagues, and I have a hunch I know who wrote this one. But anyway, I do think it's helpful if you can even collect data, for sure, monitoring data, but also stories from people. I'm working in Alameda County right now with a homeless initiative, and I have to say, they start every meeting with a client story before they get into the nuts and bolts of the technicalities of running the project. And it's a really powerful way to ensure that people stay connected to the services that they're either delivering directly or managing and generating infrastructure for. So I think that's an important one. Next, please. Next slide. Thank you. I think there's only 2 of these slides, so this is the second. You want to actively pursue the resources needed to ensure sustainability. Ron covered those with the 340B pricing, the Ryan White stuff, anything you can do to be creative and get these things funded. Look at what others have done to sustain their projects. I think that's a really helpful suggestion, especially when you have as many sites as we do. I feel like in this initiative, people definitely learn from each other. So there's no reason that can't continue in this year and the out years. Use program income. So as Ron mentioned, you can't make a profit, but you can definitely bill for services. Understand Ryan White service category descriptions and program guidance. I was just thinking about that, about sort of, how it's changed over time and what we can support with Ryan White dollars in terms of case management and transportation and things like that. We've all probably been around long enough to know that changes. So you have to keep up with what those, what the payment guidance looks like, but it definitely is a helpful resource. Consider line items that are billable, sort of on the flip side, right? Consider line items that are billable by other payers, which you guys are all probably experts at this point. And Ron talked about using rebate income in the form of 340B and ADAP. Thank you. I think that's all I got. Next slide. Oh, I'd like this. I pulled this out of the SPINS guidance around sustainability, and I just thought it was kind of wrap up. So I'll read it to you. Sustainability has traditionally been viewed narrowly as the act of decreasing dependence on one source of funding and shifting financial support for program implementation to a new funding system. In reality, program and organizational sustainability is a much more complex and dynamic process. Don't we all know it? So that's all I wanted to say. Thanks.
Thank you so much, Ron and Janet. So now would be a great time for folks to enter their questions into the Q&A box. directly at the top of your screen, I guess, unless you've moved it to the bottom of your screen. But into the Q&A box, if it happens to go into the chat, we're monitoring that as well, so that's fine too. And I think that Jane actually might, Jane might actually have a few questions.
Yeah.
Go for it.
I mean, I've worked with both Janet and Ron, and I would love to kind of hear, your thoughts on. So everyone is part of a multi-site initiative here. They're collecting data. Their data, we always say, is their own. What are kind of your top three or big thoughts on how folks can best use their data to support their sustainability or their integration?
That's a great question, Jane. I'm sort of channeling John Hannay here, but planning councils. I always feel like your first stop should be your planning council. And John Hannay's raising his hand.
He's saying, preach it, sister.
Well, I also think that, you need to show that your particular program is effective.
For sure.
And that's why, and be able to be persuasive when you present that data to your planning councils or to your local health department or other interested parties. So yeah, being able to highlight your data, the effectiveness of your outcomes in terms of the HIV care continuum outcomes, those are going to be particularly important.
Yeah. And I just want to note that it doesn't take some crazy big statistical analysis to do this. I think it can be as small as you mentioned, Janet, at the beginning of every meeting, someone has it starts with a client story. At the beginning of every meeting, we can report back in the last month how many encounters we had with clients. How many referrals did we have? Let's talk in a community meeting. How many referrals did we have and who showed up? Like really showing the benefit of connection both on the systems level and for that patient or that client.
Can you guys unmute John Hannay? And do we have to have everybody muted for this part? Can't we just kind of have a free-for-all? Is that possible?
So Jane, I just want to say, yes, I agree with you 100%. I liked what Janet said about these stories from participants and how powerful those can be. So when you're preparing your replication manual, you might want to include that as a preamble or in the executive summary, some sort of quotes from participants who really achieved something significant from your intervention. The other thing I also think that you want to show, SPINS projects are atypical from regular Ryan White services. It's an opportunity to be able to develop an innovative model, which is unique or something new. So you might also want to be able to, with your replication manual or intervention manual or part of any presentation, is to have some kind of flow chart to show how you've connected partners, which are typically outside of the Ryan White system, for this particular intervention. I think that is something that is really unique with this intervention, is that we're including a lot of players that are not typically within the Ryan White realm.
Right. Good point.
Folks, this is Jessica. We've unmuted John Hannay in case, John, you have something you want to jump in on.
Well, yeah, thank you. And thanks to Ron and Janet for some very good points. I just wanted to echo that when it comes to lining up support from other places, particularly within the Ryan White program, frequently that takes time to do. When all of you received the funding for your current awards now, I believe it was like 5 or 6 months between when you submitted an application and when you got your funding. So that is an example of how public bureaucracies work. We do not work fast. And so it's always of a benefit to talk to your people in Part A and Part B. If you are funded through Part C, talk to your program officer there. and keep everybody abreast of what you're doing so that when the time comes and you need support, they're prepared to help you with it. And allow yourself time to obtain that support. Similarly, those of us in the SPINS office in HRSA, we have working relationships with our colleagues in Part A and Part B and can help move things along from this end. So please involve us in the development of your sustainability plan. We want our successes to live on, and we do not want them to die on the vine. So please keep us involved.
Thanks so much, John. Just to let our panelists know, we don't actually have any questions that have come up in either the Q&A box or the chat. So if you all have any additional, Jane, if you have any additional questions or any final thoughts that folks want to put out there, that would be welcome.
I'm trying to think, this is Janet. I'm thinking about the Latino initiative, and I feel like you guys have a particular challenge. I don't know why. I feel like employment is hard. And I know that the situation with the housing supply is hard. So maybe it's just I mean, I guess HUD is an important, and HOPWA are important partners in this initiative. I'm just trying to think. This one seems a little bit different in the challenges that it's got.
Hi, Janet, Ron, and Jane. This is Serena. I just want to say thanks. I've been listening in, and I love all the points that you're bringing up to us. And I just wanted to say a couple of things about client stories. And maybe we can talk about this at the June meeting, but we've had, with other SPINS initiative, we've done what we call digital stories, where they're short, you know, not more than like 4 minutes, where you produce some sort of video or slideshow about clients that can be really helpful, along with any sort of data that you make for a presentation to other funders, to your Ryan White planning councils. So we have some of those available on our website. We can share some of that, and maybe it's part of a discussion we can build into the convening at some point, as well as how you build these stories or learn how to do them. I mean, nowadays the technology is so good. I'm sure people can just do it. Like my teenager could come and do them all for you, for example.
Right. Yeah. That's a great idea, Serena.
Yeah, it's a nice visual way that we don't have to wait for implementation manuals, but something we could do if you have a client who's willing. I mean, the other piece to think about in terms of Ryan White as well, but with this initiative, and Janet, your comment on employment, I know some of you are really working with the private sector. So thinking about how you might even talk to like Chamber of Commerce's or just local business associations. So it really is, going back to Ron said, how you think outside the box in terms of bringing partners together. That could also help with sustainability. And I know some of you are already doing that, and we'll share some of those at the meeting as well.
Great.
You know, Serena, to kind of piggyback on that, one of the things that I found so interesting around the digital stories was the one that was done on the other project that we work on, that was not necessarily from the patient perspective, but was from the interventionist perspective, and what it took for them to do this work, and what were both the geographic and kind of community contextual factors that supported and or impeded you know, working with this clientele.
Interesting, Jane. Good idea.
Yeah. I mean, I just think there's so many opportunities for us to showcase different perspectives of the work that we're doing.
For sure.
Additional thoughts or observations or questions that folks have? Our panelists or resident experts? spinsters.
I'm just curious if anybody on the phone has started tailoring their sustainability plan or changed their plan from what they had originally put in their grant, or at least, thought about since they got their funding.
So that's great. So if folks want to answer that question, you can just raise your hand. Right now, John Hannay, you've raised your hand again, and I've just unmuted you.
Yes. I was going to pose a question to the group as well, and that is that frequently as we approach sustainability, we get nervous and kind of scared and anxious and and that's a perfectly normal feeling to have, but wondered, who is experiencing that and what sorts of support you think you might need to get yourself started.
Anybody trying to talk? It's a little tricky. Serena, we're going to talk about this at the meeting, aren't we, again?
Yeah, I was just going to come on. We do have some breakout groups there.
Yeah.
As
So,
well.
so I just went to, oh, go ahead.
No, go ahead, Ron. Go ahead.
No, I was just thinking about what John said, because I'm sure that people get anxious and nervous about trying to do, the sustainability stuff as well on top of implementing their intervention and all the other stuff. But I would also suggest, we talked about these different, sort of 4 steps or 4 different types of activities. And really, you probably want to start simple and then continue to build to see whether or not you want to go to the large scale up. But really think about the dissemination piece, which we have to do because we're all doing implementation manuals, but different ways of really presenting your program or your data, and maybe integration, maybe take those first 2 steps, and then if your program is working well, go on to the other steps. But I think start simple would be my advice for sites.
I think the other thing that I want to say is don't be afraid to think outside of the box and think about adjacent things. One of the interesting successes that we've seen on a project that is transitional care coordination from jails to HIV community care is most of the sites, in fact, all of the sites that we've worked with have sought other funding to maintain that project by expanding into hepatitis C. And so they didn't just keep it, HIV specific. They saw an opportunity to do a similar type of work, but as I said, under the umbrella of hepatitis C.
Yeah, I mean, the other thing that comes to mind, and maybe we can do a little bit more research, and this can be so state dependent, but thinking about financing options, if some of you are, and some of you might already be involved in some projects, there are some hospital systems, ACOs that are experimenting with global payments to actually help with housing subsidies. So I don't know if there's some places in your area that are doing that, but there's some initiatives around here, like in Boston, that do that. But that's sort of creative that could even just help your organization or your staff get connected with, that can then help other people as well. So I'm just trying to think of something very different and that might be available in your area, depending on where, what the Medicaid and ACO structure looks like.
Yeah, I think that's great. And I think, maybe my example was a bit obtuse, but thinking about, other ways to support gainful employment by, looking for domestic organizations that do microloans, that, domestic, and I say that because there's a lot of international organizations that do, microloan work. But, are there community based learning opportunities that help people learn about how to start their own Etsy business? So it doesn't have to be as linear a path all the time.
I like it. Good idea, Jane.
That's a great idea.
Also in the comments, in case folks haven't opened it up, John has also said that that was a great idea, and that, in addition to thinking about hepatitis C, maybe also thinking about substance use disorders and behavioral health fields as well. Great. Well, any final thoughts, folks, before we start to wrap this up? Nope. Okay, great. Well, I want to again thank our wonderful esteemed colleagues and members of our ETAP team, Ron Brooks and Janet Myers. Thank you all so much, and thank you, Jane, for being our moderator. And
Sure, thank you.
This is how you can contact these wonderful folks if you need to. And then just a little plug, our next webinar will be Understanding and Framing Criminal Histories. And that is, we're skipping over April and going into May, so Tuesday, May 21st from 1 to 2 Eastern Time.
That's a great topic.
Yes, we're super excited about that. We're actually going to have folks from Boston Healthcare for the Homeless program and Liberty Community Services in New Haven talk about how they do this work directly with clients. So
Fabulous.
Like that. Yeah. Well, thank you all for joining us, and again, thank you to our panelists and moderators. And we look forward to seeing you in May for our next TA webinar. Have a great day.
Wonderful.
Thank you,
Thank you so
everyone.
much.
Thanks,
everybody.
everyone. Bye.
Bye-bye.